Hello everyone, now let us discuss about mock questions from E M Preventive Medicine for CPC exam. Now let us see the question. Mr. Johnson is a 79-year-old established patient who is seen by Dr. Anderson for his annual physical exam. Here, the keywords are the age of the patient is important whenever we are giving a preventive medicine code, and second case, you should see whether he is established or new. Here the patient age is 79 years and he is an established patient and he presents for annual physical examination. During the examination, Dr. Anderson notices a suspicious mole on Mr. Johnson's back. This is an undiagnosed new problem. And the doctor completes the annual exam and documents a detailed history and examination and time discussing the patient's need to quit smoking. Dr. Anderson then turns his attention to the mole and does a complete workup. So here the physician is performing two services. First of all, the patient is presenting for annual physical examination, and during the examination he finds an undiagnosed problem which is nothing but suspicious mole, and he completes a complete workup. He does a complete workup. So in this case, whenever the patient comes for annual physical examination, and the physician notices some undiagnosed problem and does workup, then you have to additionally code the outpatient services. So here you need to code two codes. One code for preventive medicine, which is nothing but annual physical examination. The other code for the workup for mole. And the patient is an established patient. Now, further, he documents a comprehensive history and examination and medical decision making of moderate complexity. Here, history and examination are simply medically appropriate. MDM is the deciding factor for selecting the code. According to the new guidelines, MDM is the deciding factor for selecting the code, and here the MDM is of moderate complexity. He also calls a local dermatologist to schedule an appointment for Mr. Johnson for an evaluation and biopsy. These are the four options. Now let us first see the preventive medicine codes. There are two set of codes in preventive medicine for new patient and for established patient. For new patient, the code set is 993812 99387, and they are based on age. 99381 is given for new patient infant age less than 1 year. 99382 is given for new patient early childhood, that is from age 1 through 4. And 99383 is given for new patient late childhood, which is nothing but 5 through 11. From 5 years to 11 years, you need to code 99383 for new patient. And from age 12 to 17, you need to code 99384. And from 18 to 39 years of age, you need to code 99385. And from 40 to 64 years age, you need to code 99386. And for 65 years and older, you need to code 99387. This is for new patient. Our patient is an established patient. For established patient preventive medicine, the code set is 993912 99397. The age classification is same. So in our case, the patient is 79 years old and he is an established patient. He presents for annual health checkup or annual physical exam or preventive medicine. So the correct code is 99397. One code is 99397. Next, coming to office outpatient codes. Here also they are categorized into new and established. The new office outpatient codes are 99202, 99203, 99204 and 99205. All the codes they require medically appropriate history and examination, and MDM is the governing factor for selecting code. In order to code 99202 for new patient, new office outpatient, MDM must be straightforward. If MDM is low, the code is 99203. If MDM is moderate, the code is 99204, and if MDM is high, the code is 99205. Or time can also be taken into consideration on the date of encounter. In order to code 99202, the physician need to spend 15 to 29 minutes, and in order to code 99203, the physician need to spend 30 to 44 minutes, and in order to code 99204, the physician need to spend 45 to 59 minutes, and in order to code 99205, the physician needs to spend 60 to 74 minutes. These are for new patient, office outpatient visits, new patient, and our patient is a established patient. For established office outpatient visits, the codes are 99211, 212, 99213, 99214, and 215. All the codes, they require medically appropriate history and examination. 99211 has been deleted. It is only used for coding ancillary staff or phone visits. So mainly for established patient, you need to code 99212 to In order to code 99212, MDM must be straightforward. In order to code 99213, MDM must be low. And in order to code 99214, MDM must be moderate. And in order to code 99215, MDM must be high. In our question, if you remember, moderate complexity medical decision making has been done. So the correct code is 99214. Now let us see the question once again. Mr. Johnson is a 79-year-old established patient who is seen by Dr. Anderson for his annual physical exam. During the examination, Dr. Anderson notices a suspicious mole on Mr. Johnson's back. The doctor completes the annual examination and documents a detailed history and examination and time, discussing the patient's need to quit smoking. Dr. Anderson then turns his attention to the mole and does a complete workup. He documents a comprehensive history and examination and medical decision making of moderate complexity. Here the MDM is of moderate complexity. He also calls a local dermatologist to schedule an appointment for Mr. Johnson for an evaluation and biopsy. So the correct option is option D, 99397 for preventive medicine and 99214 for established outpatient visit. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.